Hello everyone, welcome back to GrowMed. Uh, so in these videos we will be discussing about the surgery. Okay, so we are starting the surgery revisions, and I have already discussed the plan in the group. So join the group in the Telegram with the name GrowMed Fmge. The link is given in the description box. So daily I will be posting videos on one topic, so that will take some 7 to 8 days, and like this we will be completing the whole surgery revision. So these are like a quick recall videos in which quickly I'll be recalling all the important things which you must remember for the exam. Okay, so these are purely the revision videos which will help you in the last minutes. Okay, so let's start our discussion. We will be doing the breast today. Okay, so breast की सारी चीज़ें will be discussing, benign tumors, then cancer, then how to manage the breast surgeries, all those things. So first one is on the nipple discharge. Okay, so you can expect a question, matlab you just note down that one or two questions will be coming from the breast in all the exams. Okay, so if you watch this video completely, then easily you can score 1 mark or 2 marks in the exam. So the nipple discharge, so we can see three types of, like, various types of nipple discharges are there. First one, the bloody, then serous, then it can be greenish, blackish, grumorous, or pultaceous. Okay, so these are the kind of the discharges seen. So we should know which disease, which kind of discharge can be seen, and the investigations how we will be performing it to rule out which disease it is. Okay, so first discuss about the bloody discharge. Bloody discharge is seen in case of duct papilloma, duct carcinoma, and duct ectasia. Okay, so these are the three diseases in which we can see this bloody discharge. So the treatment for this duct papilloma is the microcodectomy. So this was a PYQ which was asked in the past years. Whereas duct papilloma, it is the most common type of the breast tumor, and it is a benign. Okay, so benign disease, most common benign disease, duct papilloma. Then carcinoma, so we all know that it is like cancer. Then duct ectasia means dilation of the ducts. ठीक है, तो mammary gland में जो ducts रहते हैं ना, those lobules, this will be getting dilated, causing this ectasia. Then moving on to the serous discharge. So serous discharge is seen in case of fibrocystic diseases, carcinoma, as well as duct ectasia. You need to remember this one main. Okay, this one and this one main, क्योंकि bloody दिखता है डक्ट पैपिलोमा में, एंड फाइब्रोसिस्टिक में सीरस देखने को मिलता है, जबकि कैर्सिनोमा में यू कैन सी बोथ द थिंग्स. ओके, एंड इन डक्ट एक्टेजिया ऑल काइंड ऑफ डिस्चार्जेस कैन बी सी. सो जस्ट रिमेंबर वन स्टेटमेंट दैट इन डक्ट एक्टेजिया यू कैन सी ऑल काइंड ऑफ डिस्चार्जेस. ठीक है, वन स्टेटमेंट रिमेंबर दिस वन, दैट ब्लडी डिस्चार्ज के लिए डक्ट पैपिलोमा एंड सीरस डिस्चार्ज के लिए फाइब्रोसिस्टिक डिसीज. Then greenish, blackish, grumorous, pultaceous, all these are seen in case of the duct ectasia. Ectasia already discussed, dilation and treatment. The Hartfield's operation, which is the conical excision of the duct. Okay, so these were the things which you must remember from this nipple discharge. And in case of bloody discharge, we will be doing ductography, which is the investigation of choice. Okay, so important things hai ye sab you need to remember. Then moving on to breast cancer. So breast cancer, you need to know the risk factors as well as all these things, like the site, most common site, and all those things which are asked in the exam, and we'll discuss all those things one by one. ठीक है, so especially those who are repeaters ना, जिन्होंने already अभी already who have given 2-3 attempts, you will be like most familiar with all the things what all you must read and all those things. So these videos are best for you guys right now, because watch these videos at least 2 times before the exam, note down all the important points, and keep on revising the notes. And for freshers, if you have finished the surgery, then these videos you can watch, but if not, then better you finish the surgery and then watch these videos. Okay, so the risk factors which you must know are the increasing age, Western countries, alcohol, fat, obesity. I'll be just saying the important things which you must remember. First one is this estrogen, because this one is like asked in integration in the clinical cases. मतलब कि estrogenicity, increased estrogenicity they will be describing in the case, and they will ask you which is like related with this. Okay, then positive family history, this is also important because this also can be described in the clinical case. Okay, then personal ovarian cancer, endometrial cancer, and this mutations. So must know topic. ठीक है, तो frequently questions have been asked on this, like simple one liners have also been asked that which of the following mutation will be most commonly associated with the breast cancer in the female. So it will be BRCA, 1 in the females and 2 in the males. ठीक है, तो BRCA mutations again important, HRT important, then radiation exposure. ठीक है, तो if it is more than 6 degree radiation exposure, then also a female is most likely to develop the breast cancer. Okay, so these are the risk factors which you must know. Then another question asked was this OCP is not risk factor for the breast cancer. ठीक है, तो which of the following is not risk factor करके ऐसा एक question पूछा गया था in the past year. Okay, then the risk factor assessment, we use two models to assess the risk factor. One is the Klaus and second is the Gale, and you need to know the names only. ठीक है, तो names are more than enough which you must know. Then some important one liners asked from the breast cancer. So the most common is the left breast, where the cancer will be occurring, and most common site is this upper outer quadrant. ठीक है, तो this one is important which you must remember. Least common is the lower inner quadrant, and spread most commonly occurs to the lymphatic spread, and site is the bones में कहाँ, lumbar vertebrae. Then secondaries which it causes mostly osteolytic kind of secondaries. Then most common histological type is the adenocarcinoma. Okay, so these are the simple one liners which you must remember for the breast cancer, and this is the pathway of the spread. And like this is like not that important, but questions have been asked on this pathway of spread, so better you have a look at it and read it once. So mostly it will be occurring to the posterior intercostal veins, then Baxton plexus, lumbar vertebrae will be involved, and if it goes to the meninges, then it will be involving the brain. Okay, so this is how it will be involving the brain and the lumbar vertebra. This is a must know table. ठीक है, so the breast cancer is classified into various subtypes: luminal A, B, HER2 positive, and tri negative, triple negative. This one is triple negative. So what you can see in this is the estrogen receptor, progesterone receptor, HER2, and this one is the Ki67. So these are the things which will be present in one and absent in one. And the luminal A, it has a best prognosis. ठीक है, so this one is the question asked like multiple times on the subtypes. So luminal A means it will be ER positive, PR can be negative or positive, and it is HER2 negative. ठीक है, then luminal B ER can be positive, PR can be positive or negative, and HER2 positive or negative, and in this the chances of Ki67 are more than 14%, whereas in HER2 new it is positive. The rest two are absent, and the HER2 is positive in case of HER2 new. And in triple negative all the things are negative, all the three are negative. Okay, so this is a must table which you must remember. Then moving on to the signs of the breast cancer, image based questions have also been asked. So do look at the images of these breast cancers. So purely orange, we know that मतलब breast जो है ना orange की तरह दिखेगा, there will be multiple dots like this present on the breast. Then dimpling, puckering, involvement of the ligament of the Cooper, and this involvement of the lymphatics. Cancer encurasis is breast skin is involved along with the chest wall. Okay, so these are the important signs seen in case of breast cancer. And image based questions, simple questions have also been asked, like they'll give the image of this purely orange and they'll ask which of the following structure is involved in case of this. So it will be the lymphatics which is involved, or they can just ask that a female presented with so and so complaint, what is the appearance seen, purely orange करके. Then the WHO classification, this classification is not that important, but like you need to know the things which you need to know is this lobular and this ductal and the lobular, and the different type of findings seen in case of the ductal and the lobular most commonly involves the bilateral. Okay, so whenever you see bilateral in the clinical case, think in terms of the lobular. Okay, so lobular will be like most commonly associated with the bilateral. Then ductal, in case of ductal a single breast can be involved, and in case of lobular carcinoma, see this is the complete classification. It is classified into in situ and invasive cancer. In situ again ductal and the lobular. So lobule are most commonly seen in the males, and this ductal equally equal in both males and females. Okay, females and males equal. This is most commonly seen in the females, and bilateral, as we have already discussed. Then another two important things which will help you to reach the diagnosis if a question is asked on the slow bar is this: Indian file pattern, a must remember uh, point, and this neighborhood calcification. So whenever you see these two things now, Indian file pattern and bilateral, think in terms of the lobular carcinoma, and this is the treatment how we will be doing it. Then based on the nuclear grade, it is again classified into low grade, high grade, and on the necrosis microcalcifications can be seen. ठीक है, this all is like not that important, but एग्जाम में लास्ट में रिविजन्स के लिए इतना पढ़ने की नहीं है ज़रूरत, बस जस्ट रिमेंबर, ठीक है. Microcalcification, so this is important because questions have been asked on this. So this was a complete PYQ, because as you can see here three options है ना, 1 2 3, so they can like ask all of the following except kind of a questions in case of this triple assessment. Okay, and it is 99.9% accurate. Then investigations. So speaking about the investigations, the two main investigations which we will be doing, first one is the mammography. ठीक है, mammography, in which all conditions we will be doing, questions are asked on this. So the first investigation will be the mammography. Like they can describe a full clinical presentation describing that a female with breast lump presents to you, the breast size is so and so, on clinical examination you find these findings. Okay, so which of the following will be the next step you will be doing, or which of the following is the first step of investigation? So the answer will be the mammography. And also you need to look at the age, because if it is a young female na, then you will be going with the USG, because the young female will be having a bulky tissue, due to which USG gives better view than the mammography. Okay, so mammography, the indications for the mammography, you need to remember these things. So more than 45 years we will be doing it, and it is the investigation of choice for the screening as well as the first investigation. So two different one-liners can be asked, or like clinical case. Okay, so you need to be thorough with this mammography. Then the mammography is done once per year in the high risk cases, like in some females, you know, who are like having family history, or who have like small lump, who presents with small lump. Right now it is not symptomatic, but later it can develop, like it can go into the malignancy. ठीक है, तो in that conditions also you need to have a look, and once per year is the criteria for this mammography. ठीक है, then this is the type of the x-ray used, not that important, but if you have time, ठीक है, तो पढ़ लेना है इसको. Then two we will be doing craniocaudal and the mediolateral oblique. Okay, so these are the things from the mammography. And what all things we will be coming to know in the mammography is, we will look at the nipple retraction or the deviation, then the skin thickening, retromammary space can be viewed, then any opacity is present and any calcifications are present. Okay, so these are the things which will be coming to know in case of the mammography. Then investigation of choice for diagnosis is biopsy. ठीक है, तो स्क्रीनिंग के लिए mammography है, but diagnosis के लिए तो biopsy ही है. ठीक है, these are the investigations. Now when we will be using the MRI as our investigation in case of the high risk females, and then implant related complications, we will be using the MRI. Then UST has already discussed young females. PET CT तो हम पता है सबको कि कोई मेटास्टेसिस होगी, उसको चेक करने के लिए will be doing this, and if bone metastasis is there, then we will be using this samarium. ठीक है, तो the two important things, mammography, biopsy, USG. ठीक है, investigations में. Then moving on to the TNM classification, again important, and you need to like mug up this whole table. You need to like mug up ki T1 stands for less than 2 centimeter, T1 T2 2 to 5 centimeter, because questions are asked like they can describe the tumor is 2 centimeter involving so and so lymph node, it is attached to the neck, attached to the chest wall, या फिर they can say ulceration, something like that, and they'll ask what is the stage. Directly questions have been asked on this. ठीक है, so don't even give a chance to miss such kind of easy questions. So when we know that this is the high yield topic, so invest your time in this and try to mug up this whole chart. And how to mug up? See, in one day at least you can't remember all these things, है ना. So just make a chart, one take a paper and pen and start noting down one, make a list of all these cancer and the TNM classification in a single book or like a paper and keep it on your study table. Daily have a look on it like for 5 to 10 minutes. Like this you will be you can also recall all the TNM classification. Okay, so this is how you can do this one. I've also given you the hint how to study this TNM classification. Then the staging, so this is also again the same thing. You need to like mug up this full. Okay, so just make a 5 star for this one, because questions have been asked like on the treatment also. They will give you the stage, that stage 4 is diagnosed. Now what will be the treatment, aise karke they can give you these options. Okay, so it is a must know thing. Then moving on to the types of the mastectomy. So these are the types, and you should know कि किस type में कौन सी वाली operation होती है या फिर what is the procedure. So the example, simple mastectomy. Simple means we'll be just removing the क्या बोलते breast. Okay, simple mastectomy. Extended mastectomy stands for what? Modified radical mastectomy, halted radical, extended radical, and super radical. ठीक है. So what does this stand for, and which all structures are being removed in these kind of mastectomy? You need to know. Then breast conservation surgery, again an important, and what all we will be doing in this breast conservation surgery is we will remove the lump. So lumpectomy will be done. ठीक है. Wide local excision less than with 1 centimeter margin, wide local excision, and whole quadrant excision. Quadrantectomy we will be doing in case of breast conservation surgery. If contraindication is present for this breast conservative surgery, then we will be doing simple or total mastectomy. Okay, so this is one important thing which you must remember. Then questions are also asked on the contraindications of the breast conservation surgery. Like we had discussed ना, यहाँ पर हमने discuss किया कि contraindication if present, so we should also know ना which contraindications are present, because just like that you read one statement and you'll remember it, and what if in question the contraindication is asked. Okay, so let's look at the contraindications, absolute and the relative. So these are the absolute contraindications in which we cannot do the breast conservation surgery, like pregnancy, more than 2 tumors in 2 different quadrant, diffuse malignancy, positive margins, and history of radiation exposure. If these findings are present, then it is an absolute contraindication. We just cannot do this. Then speaking about the relative contraindications, we will look at the other various factors affecting it, and then we will decide what is the best treatment. Okay. So relative contraindications like collagen vascular disease, then multiple tumors in the same quadrant, large tumor, large pendulous breast, and centrally located tumor. Okay, so these are the things which you must like mug up by heart. Okay. Then breast reconstruction, not that important, but better you read it. So 3 types होते हैं, autogenous, alloplastic, and combined. Autogenous तो we know own tissue ना. Own tissue में क्या क्या आएगा? Tram flap, this one is important, and also this DIEP, deep iliac epigastric something this stands for. Okay, so this flap and the tram flap is the most commonly used, but disadvantage is that it will be causing this hernia. And LD, latissimus dorsi flap, it is the subcutaneous flap, but the best flap is this DIEP. Okay, then moving on to the prognostic factors, so just have a look at it, not that important. So how we will be calculating the prognostic factors by using these scoring systems. Then again, sentinel lymph node biopsy, clinical case has also been image based question have been also asked on this sentinel lymph node biopsy. Maybe I have an image, let me show it to you. Okay, so this one is the sentinel lymph node biopsy, and image based questions have been also asked, like which of the what procedure is being performed in this image, or where we will be injecting the dye. So first look at the indications when we will be doing the sentinel lymph node biopsy. When there is clinically non-palpable axillary lymph node, that time we will be doing this. And the site of the injection of the dye, you can see here that a dye is being injected at the site of the areola. Okay, so this have been like asked as a one liner. Then 2 techniques are there. One is the blue dye technique, which and in this technique we will be using 1% lymph urine, whereas radioactive collide technique we will be using technetium 99 labeled sulfur. Okay, so questions have been asked on this complications of the sentinel lymph node biopsy. So skin tattooing is the most common complication, but it's not that serious, because this will be like this will go by itself. Okay, necrosis can be there, urine discoloration, anaphylaxis can be there, and the serious a complication is this intercostal brachial nerve injury. So questions have been like asked, which of the following nerve is most likely to be injured in case of sentinel lymph node biopsy or during this procedure, and it is the intercostal brachial nerve injury. Then contraindications for this SNL are palpable lymphadenopathy, prior axillary surgery or chemotherapy or radiotherapy is given then, and the multifocal breast cancer. In these conditions we will be avoiding this SLN. Okay. So these were about the things which you must remember from the cancer. Okay. So cancer ki you need to know the staging of this cancer, this classification of the cancer, then what all features of the cancer, these things, the signs, and the simple one liner, then the subtypes also important. Then after that, the investigations, how you will be doing the investigation, TNM classification a must, and along with that these uh, what do they say, management techniques like breast conservation surgery, types of the mastectomy, and all these things. So these all are like a must to know topic, and I've compiled all the important things in a like 4 to 5 pages to make it easier for you, that you will be like completing, watching this one video from the breast, you'll be completing all the important uh, points which you must know for the breast. After watching this video, take the Fmge solutions breast, open the breast part and start solving the MCQ, and Fmge solution at least solve the MCQs 2 times. Okay, then along with that you can also go with the marrow q bank, या फिर दूसरा कोई भी q bank आपके पास है तो solve the questions from this breast. Okay, so inflammatory breast cancer, which is also known as the mastitis carcinomatosa. So this one is the staging, and this one is like a very famous question asked, that inflammatory breast cancer is क्या बोलते हैं, comes under which staging of the TNM classification. So it is a T4D. T4D comes for the inflammatory breast cancer and stage 3D. So must know topic. Then it behaves like locally advanced breast cancer. So these are the clinical features which are seen of this inflammatory breast cancer. There will be inflammatory changes present, as the name itself says, that is inflammation along with the breast cancer is also there. So you can note erythema, brownie in duration, early onset pudy orange because of the early distant metastasis. Okay, so pudy orange, I think I've not shown you the image. Okay, let me show you the image of this pudy orange also. Okay, so this is the image of this pudy orange, and we have already discussed upper mein na, this is an important finding of the breast cancer, and you can see here that this breast, it appears like an orange, and you can see multiple dots like this. Okay, so this feature image based question have been also asked on this. Then axillary lymph node metastasis associated with this inflammatory breast is 75% and distant metastasis 25%. So investigation of choice is the skin biopsy, and this one is the treatment modality which we will be doing it, NACT, neoadjuvant chemotherapy, modified radical mastectomy, as well as the radiotherapy. Okay, so these are the important things which you must remember from the inflammatory breast cancer. Just don't forget this T4 wala, the inflammatory changes, and this investigation of choice. Then breast cancer in the pregnancy. So in case of pregnancy, we will be using ultrasound as the investigation, because mammography is like highly क्या बोलते हैं, dangerous, and it will be affecting both the mother as well as the baby. So to avoid that one, we will be using USG. So indications of USG we have already learnt in 2 conditions, one in case of the pregnant woman, and if you are able to recall, then young female who are less than 35, in those we will be doing the USG. Okay, so these are the 2 important indications for the USG which you must remember. Then investigation of choice for diagnosis is anyways biopsy. Then these are the treatment modalities which we will be using in case of the breast cancer in pregnancy. Then now let's quickly discuss about the benign tumors of the breast, and we'll wind up this video, and in the next video we will discuss about the important things which you must know from the thyroid. Okay, so Paget's disease of the nipple, again very important, and questions have been like repeatedly asked on this Paget's disease of nipple, and it's quite simpler. Okay, so if you have watched the video of this rule out method of solving the MCQ, which I've already posted, and by that you can like get an idea about this disease. If at all nipple, this Paget's disease of nipple is given in the question, and they describe few options giving this nipple, then a ligament of Cooper, that they will be like, let me explain it clearly to you, a clinical case, and they will describe that a patient with complaint of nipple aeration, like this, eruption of the nipple, chronic eczematous eruption of the nipple, and on examination you see something like this. These findings are visible on the examination, and uh, this Paget's disease involves which of the following structure? So they can describe nipple, then they can describe like areolar tissue, lymph node, three skin, or chest wall or ligament of Cooper, something like that. Okay. So rule out with this, using the rule out method, you can rule out that the Paget's disease is a disease of nipple, ruling out all the other option, because skin will not be involved in this case, then areolar tissue will not be involved in this case, and likewise you can come to a conclusion. Okay, so this one is associated with the DCIS and invasive ductal carcinoma. Okay, so the ductal ones have a higher risk of developing the nipple. Then it is CEA positivity can be seen, so you can say that like it will be acting as a marker for this disease, and investigation is complete mammography plus biopsy. Treatment will be the simple mastectomy, and this one is the image, and image based question can be asked. Then the phyllodes tumor. So this phyllodes tumor, which is also known as the cystosarcoma phyllodes, because on cut appearance it looks like a leaf appearance like this, and it gives a like, if you see the gross appearance, no, it will appear bosilated, very huge breast with bosilated appearance. Here image you can appreciate this one. Okay, then it is called a sarcoma because there is hematogenous spread seen, and this one is like a hint I will give it to you, that whenever you see sarcoma in any of the tumor, think that it has an hematogenous spread. All the sarcomas will be having hematogenous spread, and the most common site will be the lungs. So note it down somewhere and mark this, apply this concept with all the tumors wherever there will be sarcoma. Okay, so this is about this phyllodes tumor. Then dual origin, it has mammillary epithelium and connective tissue stroma, and these are the clinical features which I've already discussed, that massively enlarged breast, pressure atrophy or necrosis of the skin, busylated appearance. And the important question which you must remember is that the nipple, the skin and the chest wall, these are not involved. All these things will be appearing normal. Okay, so the chest wall will not be involved. Then nipple, if you see now, so in this we had seen that the nipple is involved, and you can see eczematous like a reaction on the nipple, but in this the nipple will not be involved, and the nipple will be normal in this case, and even the skin also will be normal. Okay, so it can be benign, borderline or malignant, and these are the treatment options which we will be using. Then fibroadenoma, the most like common क्या बोलते हैं, most common tumor, benign tumor seen in the females, and like I've seen, it's my fourth or fifth day of the posting of the surgery, and in these days I've like seen around 6 to 7 females coming to the OPD with this fibroadenoma. So it's that common, and you need to know all these things regarding this fibroadenoma, and you can like surely expect one question from this one. So it is benign tumor, and it is a stromal origin in young females, seen most commonly in the young females 15 to 30 years. Most common is the lump and mobile lump. See, this one is the hint word. Whenever in the question you see mobile lump or breast mouse, just blindly mark the answer as the fibroadenoma. Look at the age. If the age is being described between 15 to 30 years, and mobile breast lump, blindly mark the answer as the fibroadenoma. No need to think more also about it. Okay, so fibroadenoma, how to crack it, I've discussed it to you. Then investigation is the FNSC, investigation of choice, and mammography you can see popcorn calcification. So this is the popcorn calcification scene. Okay. Then observation and surgical excision we will be doing. So fibroadenoma a must do, and also quite easier है ना, young female mobile lump. Then breast abscess also a must do topic. And how to identify the breast abscess, quite simple. Lactating female है, female who had delivered, like they'll be describing delivered 5-6 days ago, is exclusively breastfeeding, and she complains of redness, erythema fever, redness, breast is engrossed, skin erythema. All these things will be described. What is the diagnosis? Simple है, breast abscess. ठीक है, तो एब्सेस में व्हाट ऑल फाइंडिंग्स यू कैन सी, एब्सेस में यू कैन सी लाइक पस ना, पस विल बी देयर, देन रेडनेस विल बी देयर, फीवर विल बी देयर, एंड breast involvement of the breast is there, and one hint word, lactating female. Whenever you find this clinical history given, go with the breast abscess, because this is also like quite uh, famous question asked in the FMG, and most common causes is staph aureus, which you must know. So like simple one liners have been also asked on this, the most common cause of the breast abscess and the treatment. So this treatment part is the favorite question of these FMG examiners, and they're like constantly asking the question on the management of this breast abscess, which is incision and drainage plus antibiotic. Okay, and if there is no drainage present, then you will not be doing this incision and drainage. Instead, you'll be just prescribing the antibiotics if there is no drainage present. And this is the image of, okay, I'll show you the image of this breast abscess, how it looks. Okay, so you can appreciate here that there is this finding seen with the pus present inside it. So you will be doing incision and drainage, and if clinical cases are, sorry, image based question is also answered, then you'll now be easily able to solve it. And in case of the recurrent breast abscess, this is called as a Zuska's disease. Simple one liner which you must know. Okay, so these were the things from the breast which you must know. All the important things have been covered in the single video for the breast. So like in around 25 to 30 minutes, you will be able to recall all the important things which you must know from the breast. Watch this video at least 2 to 3 times and note down all the important things which I've told you, and also solve the MCQs. And if I've missed like any point from the MCQs, so note it down here. So thank you so much for watching this video. Stay tuned for more videos related to the surgery revision, and I'll be soon posting all the videos. Like we will go it in a fashion like breast. First we'll discuss the breast, then we'll go to the thyroid, then later we will go to the GI diseases, or I'll be discussing about the liver, and then like slowly we'll cover all the important things from this surgery. For more amazing stuff, join my Telegram channel, the link will be given in the description box. Thank you so much for watching this video. I am Dr. Padmini, your mentor for the FMGE. If you are new to GrowMed, subscribe to GrowMed, and for PDF also join my Telegram channel. Once again, thank you so much guys. Bye bye.